Welcome to the Hit Like a Girl podcast. This is HITea with Grace, where we spill the tea on HIT. I'm stoked to introduce you to Rebecca Gwilt and Carrie Nixon. They are digital health lawyer extraordinaires. Thanks for joining us today, ladies.
Thanks so much for having us.
So excited, Grace.
So tell me both about the journey that brought you to your position today. Rebecca, let's have you start, and then Carrie, have you share your story.
Yeah, this is actually a story that we tell often together, and sometimes we sort of take each other's part in the story, but I'll tell a little bit of it. My background is as a person with a passion for healthcare access, healthcare reform, helping people live longer and healthier lives. I started out my career in policy, as did Carrie, working for the Obama administration on the implementation of the Affordable Care Act, and I really got hooked on the intersection of policy and sort of the leading edge of where healthcare was going, and technology. One of the large projects that I worked on in the administration was a very large technology implementation to do eligibility for Medicaid and the new exchanges. And I sort of learned to be a translator between tech folks and policy folks. And I went to a tech company after that to head their national healthcare policy team. And yeah, I had the bug. I after that, I'll let Carrie tell the rest. But after that, I had sort of a vision for what I wanted to do, and I'm very, very blessed to be able to say that with Carrie, I made it happen.
My first exposure to healthcare was actually in my first job out of college when I worked on Capitol Hill. I ended up in the position of assistant policy director for the House Democratic Caucus, and I got put in charge of one of their healthcare, one of their task forces focused on healthcare. And at that time, and this will date me, the Children's Health Insurance program was winding its way through Congress. And I thought, gosh, this is really interesting. I then went to law school, as had sort of been the plan after, getting a couple of years on the Hill under my belt. And when I graduated from law school, I took a job in a large law firm in Washington, D.C. in their health law practice, because, I thought this is a really good area to be in. And that's kind of where I got my chops in healthcare law in general. We served clients that were sort of large, tended to be like larger institutional clients. So it's a little bit different than what we do right now. But after a number of years at the large law firm, I decided to take on my first entrepreneurial endeavor and become the first full-time person at a nonprofit that my husband and I had been involved with starting, that again had a policy focus. And then fast forward a few years of getting that policy, that nonprofit up and running and standing on its own 2 feet, I decided it was time to get back to the practice of law. And that was in 2010. It was when the Affordable Care Act had passed. And I thought, gosh, there are going to be some really interesting opportunities here for players who hadn't necessarily been involved in the space before to move the needle on outcomes and, cost reductions that burden our system so much. And so I decided to actually start my own practice and did that, sort of built up a core clientele eventually over, a number of years. And, it was just me initially, but I sort of had a bigger vision and didn't want to necessarily do this on my own, and was very fortunate to find Rebecca through a random connection, which is wonderful how that happens at times. And we started working together for a couple of years, and I decided this is the person that I want to build this firm with. And she and I kind of realized in 2016 that the clients that we liked working with the most were the innovators in the space. And so, the digital health companies, the health IT companies, the medical device companies, the providers that were kind of doing new and innovative business models. And so we decided to, not really just focus on health law, but to focus on healthcare innovation in our law firm. And that turned out to be a very fortuitous decision back in 2016. And, there has been a lot of desire for healthcare innovation and need for healthcare innovation. And we have grown as a firm quite a bit. We have a national presence at this point with attorneys, all around the country. and serving clients all around the country and internationally. So that was a very long-winded introduction, but I think it kind of sets the stage for how we got to where we are.
It really does. I mean, why do just any law when you could do law that saves lives? Carrie, I would love for you to show our audience your superhero photo of you and Rebecca. If you could just bring that up to the screen. It's just too fantastic.
Yeah, this is it, if you can see it. It is a colleague of ours gave this to us and had it done, just with sort of our headshots. And, this is sort of us as the dynamic duo, right? And, Rebecca found these amazing shoes that we actually should have brought in to show you, that have BAM and POW in them. They're these great sparkly shoes that she and I sometimes wear together when we're at conferences.
That is just too fantastic. So you guys aren't just healthcare attorneys, you're healthcare innovation attorneys. Tell us a little bit about what makes the firm you built a bit different than others out there.
Yeah, we've had to learn this over time because, I came to founding this law firm from sort of policy and government world. And unlike Carrie, had not worked in a big law atmosphere. And I think that gave me a unique perspective. Carrie and I were able to build a firm based on what we thought it should be, and not just sort of what we had seen modeled in the past. And what I have learned over time is that there is absolutely a place for very, very smart, qualified healthcare lawyers to do the sort of traditional healthcare work. And we have lots of colleagues in those spaces, and we respect them immensely. What we decided, really because it was the most fun of all of the sort of general legal work that we were doing, was that technology and data and harnessing technology and data to give insights that we've never had before, identify issues that have never been named before, reach populations that haven't been reachable because we haven't been able to see them before. That was really what's going to change things. And frankly, healthcare lawyers do not get technology training. And so Carrie and I, in the very beginning of our partnership, learned it, taught ourselves the intersection of the law and software and hardware technology and healthcare data and data analytics. And we were very lucky to have some early clients that trusted us to sort of learn alongside them. But I would say one thing, and I'll let Carrie answer too. One thing that sets us apart is that intersection of expertise, is really understanding like the substantive legal issues that come up in that space, which are not encapsulated within sort of traditional healthcare law. And I'll add one more before I turn it over. And that is that Carrie and I are both pretty entrepreneurial in nature. And we've built our firm and culture and training based on really understanding and getting passionate about the process of building a company, so that we can really, right alongside the entrepreneurs that we serve, grab their shared vision and drive toward it with the skills that we have alongside them and the skills that they have. I'll turn it over to Carrie.
Yeah, I think that's exactly right. I mean, we have, in addition to sort of serving innovators, we are innovators in the legal services space ourselves. We tend not to work by the billable hour, which is sort of, what a lot of people hate about attorneys. We have come up with alternative arrangements for working with clients that we think are much better than the billable hour at actually aligning incentives. And, we have created a work environment for our firm with a core value of belief that our lives outside of the law firm make us better attorneys overall. And so that's sort of another, I think, distinguishing characteristic. In terms of sort of the clientele that we serve, I mentioned during my large law firm days, serving some large institutional clients, health systems, payers, large provider groups tend to be very bureaucratic. They tend to therefore move very slowly. And for good reason, they tend to be very risk averse. That is a very different client profile than healthcare innovators. Innovators in the space are moving fast. They are seizing opportunities as they come along. We saw this during COVID, where a number of our clients pivoted very, very quickly to act in the COVID space in a way that could be helpful overall. And frankly, they are more comfortable in gray areas, sort of on the legal and regulatory front, right? So they may be, whereas a large institutional client may be very, very risk averse and not willing to accept any risk, innovators may look at the gray area and say, hey, this is an opportunity for us to innovate within that gray area. That's where the innovation happens. So our job is to inform them of the degree of risk, right, that is involved. And some innovators are very, very willing to say, yeah, we don't want to cross the line. We don't want to do anything that's wrong. But where we can make an argument in a gray area, we're going to take that opportunity, because we believe that, innovation, what we know is that policy and regulations lag behind innovations in the healthcare space. A technology innovation comes out, it's something that the policy and the regs have never considered. And by the time they catch up, the technology has leapfrogged again. So innovators understand that.
I would love to dive more into that, the role of policy and law. What is that role of policy and law in really promoting or stifling innovation in the health tech space? Like, can you kind of dive more into that?
Go ahead, Carrie.
Yeah, so it's a great question. The law and policy can certainly stifle innovation, right? That is because, as I just mentioned, it tends to lag behind technology. Mm-hmm. In some instances, though, there is sort of a, especially if something is a legislative action, right? It is put into place with an act of Congress. Congressional inaction causes sort of a stalemate and a lack of innovation. A great example of this is what we saw happen during the pandemic, where telehealth was not widely available to the public during a public health emergency, much less otherwise, right? Physician practices and health systems were not ready to pull the trigger on going to a virtual care telehealth model when they had to, when it was dangerous for people to be coming into an office setting live. And that was because back in, I think it was 1997, Congress passed a law saying that telehealth for Medicare beneficiaries, and Medicare, as you know, is like the largest payer, in the country. Mm-hmm. Telehealth could only happen when a patient was at what's called an originating site, meaning they had to go to a clinic, and then they had to have telehealth technology, audio video technology at that clinic that could connect them with a specialist in the big city, right? At that point, telehealth technology was only really viewed as useful for helping people in rural areas that may not have access to specialists get specialists. Okay, great, in 1997, fine, right? That law did not change until actually, like a week or so ago, right?
Yeah. Wow.
Right?
Wow.
So no change to that law. So we had the public health emergency, and Medicare is the biggest payer, leads the way.
Also the most vulnerable patient population.
Most vulnerable patient population. Medicare leads the way in doing things. And because Medicare wasn't paying for telehealth visits, physician offices and health systems weren't providing it. And so this put us at a real disadvantage during the public health emergency. I'll stop there, but I think it's a pretty good example of the way, legislation or a regulatory construct can stifle innovation. The technology for telehealth is nowhere near where it was in 1997. It was easy for people to use their phones, right, to be able to do a telehealth visit, which didn't even exist in 1997. So that's one example.
Yeah, and I'll say, I think Carrie, in my background, her working in Congress and me working from inside of CMS inside of a government agency has given us real insight into why sometimes policies don't move forward and what that means for industry. So, I firmly believe, and when I was in the government, was very passionate about making care better for the people of this country. Giving more access, providing more opportunities. But I would call out two things. There are more, but two things that I think hold us back, even if we're really committed to it. One is the government is a massive bureaucracy, and so moving things takes time. I think everybody knows, what the issues are we're having in Congress. That's quite political. But even once it gets through Congress, then the agencies have to implement it. It's an enormous ship to turn. Lots of different opinions, lots of different people. The second is that technology is moving at lightning speed, and there's just not subject matter expertise within the agencies that are moving as quickly as the technology is. And so where Carrie and I sit, we are definitely not lobbyists, but we are on the ground serving hundreds of these innovators. We are learning about these technologies, and we can see very clearly why and how the policies that sometimes come out of the agencies may be counterproductive to their own goals. And so we're able to bring them that knowledge. And it is several times in our short history, just commentary and consultation with industry groups by our law firm has changed policy at the federal level just through education, not through advocacy, nothing like that, just through explaining how the goal that the agency has is better served by describing something different or creating a different policy. And so I would encourage all of you out there in digital health tech to think through when a policy doesn't make sense or a reimbursement rule doesn't make sense, the fact that it's possible that just educating the agencies that are paying you and regulating you can move the needle, because they want to be effective, but they're not living in Silicon Valley and in Austin and Miami, and they're not watching this day to day. So that's my 2 cents.
You really sit in the middle of many of these innovations happening in this space. What are some examples of leading innovations that you're starting to see more and more of? And what are some of the legal issues that you're starting to deal with now that you're working with some of these additional innovations?
So many.
It's a really exciting time. Yeah, I mean, we can sort of rattle off some. One of the things that I'm particularly interested in, and I've written a little bit about over the last year, is what healthcare is going to look like in the metaverse. And I could talk for many hours about that, but I won't. But there are very cool innovations happening in the virtual care, augmented reality, extended reality space that I'm starting to see as solutions. One of our attorneys, Caitlin O'Connor, has made this a particular focus for this year, and has been lucky enough to meet a number of these companies. I think that's going to be, the paradigm for how we receive and experience healthcare, which is actually the theme of our podcast. But the paradigm of how we receive and experience healthcare in a more virtual world is so much broader and more complex than just a face-to-face video visit. So that's one area that I'm pretty excited about.
Yeah, and I would say another is the shift to care at home. Having patients experience a more continuous and high touch from their providers, particularly those that have chronic diseases, right? So the advent of remote monitoring and reimbursement for remote monitoring means that people with hypertension can monitor their blood pressure with a Bluetooth blood pressure cuff, have someone on the other end of their provider be kind of monitoring that data, their blood pressure readings, on a frequent basis. And that provider can reach out and say, hey, you know what? You've had a pretty high reading for the last 3 days. Call on the phone. Tell me what's going on. Are you out of your medication? Are you having a particularly stressful period of time? And that high touch really makes a difference in improving patient outcomes, right? It eliminates, it can potentially eliminate the need to go in for an office visit. It can certainly eliminate the need to go into the emergency room, right? Or the ER and be admitted to the hospital. And by the way, that aggregation of data is very valuable in and of itself, right? Like what does this data for this whole patient population of hypertensive patients show us in general, and how can we use that data to build algorithms that are going to help, predict different outcomes that are going to help us improve patient lives further.
So you both have mentioned to me that you're seeing much more of a global healthcare innovation ecosystem. How are you seeing this manifest in the U.S. healthcare market?
Yeah, this has been pretty exciting, and it's also really being embraced by the industry. I think there was, after COVID, I think there was a global acknowledgement that we're sort of all in this together, and we need to be a little bit more coordinated. And that has sparked some partnerships and sort of visionary initiatives to really connect to the international community. What's very cool is that there's a ton of innovation happening in Asia, in Europe, in India. Lots of, they're building digital health tools too. They're building devices as well. They've got different patient populations, but similar problems and or challenges rather. And they're starting to talk with each other across the globe about what it's like to sort of build businesses. So we've watched our clients move from the US into other countries to expand their brands. But more than that, we're starting to see international companies want to enter into the US market. I have seen more of that over the last 2 years than I had experienced prior to that. We've served a number of clients that have come from Europe and even as far as Australia, who are quite interested in certainly the massive patient population that we have. They're interested in a patient population that is willing to pay out of pocket for healthcare, which is not the case in other countries where socialized medicine covers more than it does in this country. And they're coming over for the reimbursement opportunities that we have in this country. What we have found is that it's often a rude awakening. And so one of the things that we're doing this year is we're getting much better at education for international companies that want to establish themselves in the US, helping them understand not just the sort of the nuts and bolts of the corporate laws in this country, but what does our healthcare system look like? Who's buying healthcare? What does it mean to have a federal system and a state system? All of these things, there are lots of sort of assumptions and expectations about what it would be like to do business in this country that we have noticed that we've had to learn and unteach. And but so it's exciting for us, but I think we're going to probably see more of that in years to come. What do you think, Carrie?
Yeah, just briefly, an area in particular that I think we may see more of this is in the medical device and software as a medical device industry.
I could imagine, because it's really exploded overseas.
And it is also the case that there's a lot of venture capital in the US, and many of those firms require that your IP is housed in the US before they'll invest. So there's a lot of reasons for companies to come here, and I'm here for it. I'm excited.
Yes, it's very exciting. I mean, it's really the whole world coming together to help improve outcomes and care experiences for all. It's really fantastic. So I'd love to dive in now to your personal lives. Women leaders of this fantastic digital health innovation firm, what are some things that you do every day to help you work your best and make a difference?
I'll say I have a daily gratitude practice, which I've been doing ever since I watched Oprah on Super Soul Sunday in 2008. And she said something like that. And she said, this will change your brain. Your brain will change when you remind yourself every day what you're grateful for. And it's absolutely my secret. So we do that. We have just nuts and bolts. We have a lot of tools, technology tools that help us on a day-to-day basis. And I'll say we have an incredible team that is values aligned, that really enjoys collaborating and working with each other, that raises their hand when someone needs help. And I'm including Carrie in that. I absolutely could not do this alone.
Yeah, agree 100%. My family does a Grateful For's a dinner time as well. And so, especially when things get tough, where, and I'll say we had just a really intense year in terms of growing and scaling the firm, right? Going from like a smaller firm to now, sort of a medium-sized firm that needs to have different sort of processes and in place. But that gratitude practice is particularly useful when you're sort of in the throes of, oh my God, like there's so much to do and so little time, and how do we do it all? That has been really important. And then I will also say that I know for both of us, having spouses that are very supportive,
absolutely,
us, and share responsibilities with us and our families, has been really important as well.
That's right. Shout out to Justin and Dimitri. We also could not do this without you. And I'll just harken back to what Carrie said in the beginning, which is, we really do believe that we are better people and lawyers when our lives are not just work. And so one of the other reasons that we're able to handle what we can handle is we constructed a firm that doesn't require that people work 7 days a week. Our people have their nights and they have their weekends, and sometimes we have to put in the work, but we are able to recharge. And I think that's been really, really important to really unplug. I've got 3 children and I want to be with them, and I want to see them grow up, and I want to go to practices, and that is what recharges me. And I'm grateful to have had the autonomy and the partnership to build a company that allows me to do that, and that we can give that to the people that work for us as well.
Yeah. For example, we generally close the firm between Christmas and New Year's, right? The week between Christmas and New Year's. That's not always sort of the most popular thing to do for our clients, but I think they respect it, and our team really appreciates the opportunity to be with their family, to rest, to recharge, and to get a good start on the new year.
I just love that. You've said a lot of this, actually, what my next question is going to be already in your answers, but do you have a leadership quote or concept that really impacts the way you lead? And if so, what is that?
Yeah, I think we hearken to our core values, which Rebecca and I have, made a point of articulating when we joined together in this partnership, and which are our guideposts for the way that we conduct the firm, and I don't think have really changed at all over the years that we've been working together. One of the most important ones is do the right thing always. That is probably the number one guidepost that we all try to live by. Another one is to innovate and evolve constantly, both as individuals, as a company, as a firm, alongside our clients. And another is, which I think does sort of set us apart from some other law firms, is wear your lawyer's hat, but walk in your client's shoes. Think like a lawyer, but understand what your client is really trying to go for, and help them to get there. Rebecca, there are a couple others.
Yeah, we respect and inspire each other every day.
I love that you both sat down and articulated that together. I rarely hear of companies really taking time to put in words what their leadership guidepost is. And I'm sure your employees greatly appreciate that. If you could give advice to women looking to get into healthcare innovation law, what would that advice be?
Have confidence in yourself, right? I think that women in particular are less apt to have confidence that they can jump in and do something new and different all on their own. And that's a really important thing to know and to understand. We are all smart individuals. We are all capable individuals. We are just as well suited to do any of these things as anyone else. I think that, men tend to be a little more brash and confident in taking on new things and saying, yep, I can do it. I can do it. Women tend to be a little more hesitant. And, I think having confidence to be able to jump into something new is and knowing that you can succeed is really important.
I would just echo that. I think one of the things that Carrie and I have said to each other over time since the beginning of all this is, why not us? Why not us? And every time we thought, well, somebody asked a question we didn't know the answer to, or we got nervous that the gamble that we had made wouldn't work out. And we just thought, why not? Why not us? Why wouldn't we be successful? And I think there's a little bit of manifest in that. There's a little bit of, I see it. I can't think of a reason why I couldn't do it, so I'm going to do it. I do think that talking to this community that you're building here, frankly, Grace, talking to other women who you say something to you'll say something you're nervous about, well, I think I can do this, or I want to do this thing, and having the person across the table from you saying, like, why not you, is pretty meaningful. And I have, in my own life, I have got, shout out to the Boss Moms. We have a text chain with a bunch of women entrepreneurs that are in my local area. And this is what we do for each other. When we have a challenge, we shout out to the Boss Moms and we say, is this crazy? Should I do this? And everybody goes, yeah. And we need that from each other. So I would just say, do it. It's not very sexy, is it? I should have planned and come up with a real quote from Mark Twain or someone, or,
honestly, why not us? And that's the quote from Rebecca Gwilt today. So why not us? And I would love for you folks listening in to have a why not us moment right now and write it in the comments, manifest it, and let's see if our community can help you do it. To finish this conversation off right, where can our listeners find you both online?
You can find us on LinkedIn at Nixon Gwilt Law, on Twitter, I believe, at Nixon Gwilt Law, and our website, www.nixongwiltlaw.com. We have a fantastic, if I do say so myself, monthly newsletter that updates you on all the things that we've been seeing, new movements in policy and law around innovation, podcast episodes that we're doing, webinars that we've done, lots of resources, and just once a month to not crowd your inbox. We also, if you sign up for Carrie's newsletter on LinkedIn, and we'll send it to you so you can put it in the show notes. We do for folks that are running multi-state digital health tech-enabled services companies, so telehealth companies and RPM companies that have clinical arms. We do a monthly newsletter with updates from the individual states of laws that are changing that might impact your business. Lots of content, and we'd love to help as much as we can.
Now, before I forget, did you happen to bring tea with you today, ladies?
Yes,
We
indeed.
did.
Yes, indeed.
All right. So tell me about your mugs. Carrie, you start.
Yes. So this is a mug that was a gift to me from Rebecca. It is a roaring cat that says resist, and the back says persist. And Rebecca got this for me in the throes of some of the attacks on women and women's rights, and that we saw, during the years of the prior administration, frankly, and that is a passion that both of us have shared, and so it is a very important mug for me.
Yeah, shout out to all the innovators in women's health and femtech right now. They are waging war right now, and we are 100% behind them.
Absolutely. Rebecca, now show us your mug.
All right, so mine was a gift from somebody on my team. Can you see what it says?
Other bosses. And me. It's a unicorn on a pole dancing.
Yes.
That's fantastic.
And I do want to say thank you to my unofficial sponsor, Ticino. I cannot stand caffeine. So if you ever see me anywhere and it looks like I'm drinking coffee, it's a facade. But I do have my non-caffeinated Ticino along with me. I have it every single morning.
That is fantastic. Too good. Well, thank you both for joining me today.
Thanks so much, Grace. It was really fun.
Thanks, Grace.
And thanks to you guys too for joining as well. Check out the Hit Like a Girl website page and YouTube for more great guests like Rebecca and Carrie today. Cheers.